Assalamu alaikum everyone, my PGRs and my online audience. Now I'm going to start the second session of ECG Made Easy. And yesterday we have gone through the graph paper, electrodes, leads, ECG waveforms, and the progression of ECG waves, heart rate calculation, and rhythm identification. So we have gone through the very basics of the ECG. So today we will have a discussion on the axis, that is very important concept, then hypertrophy of the heart and bundle branch blocks and ischemia. And as these are more clinically related, so I hope you will be much more engaged than yesterday. Okay, now first of all, the concept of the axis. So about the concept of the axis. Now, why we are going to learn the axis of the heart. So the axis of the heart is infralateral, but how will you know that the heart's axis is normal on ECG? You will have a left axis deviation and the right axis deviation on the ECG tracings. And now what is the left axis deviation and what is right axis deviation and what is the normal axis of the heart? How to see it, how to learn it, how to observe it on the ECG tracings. Today we are going to do that. Now, by identifying the axis of the heart, we can identify different cardiac pathologies. Like the most commonest ones among here, as you can see, like first of all, most common one is a left ventricular hypertrophy, left bundle branch block, left anterior fascicular block, and on the right axis deviation side, you can get right ventricular hypertrophy, you can get left posterior fascicular block, you can get, you will be able to identify right bundle branch block, different arrhythmias, pulmonary embolism. And these are the other ones, as you can see on the list, but the most commonest one, or you can say the more important one, as I have already marked them. So by knowing the axis of the heart, you can identify the different pathologies going on inside the heart related to the conduction defect. Now, how to determine the axis? Now, this is a bit complex idea. I want your full attention, full focus on the screen. Now, there are two methods, but I will go for the quadrant approach because this is my favorite one and that's the easiest one. So let's see how we do this. Now, when you see the QRS complexes or when you see the ECG tracings, what you do? For axis deviation, you have to choose lead 1 and lead AVF. You have to look for axis deviation in lead 1 and lead AVF. Secondly, now look for QRS complex deflection. Positive upward deflection or the negative or downward deflection. So in which lead we have upward deflection and in which lead we have a downward deflection. Now let me clarify this upward downward deflection. Sometimes we have both the waves in ECG, like R wave and S wave, we have both the waves. But we have to look for which one of those waves is more, or you can say predominantly deflected, like which one is more taller or deeper. Like for instance, in this ECG tracing, you can see that we have R wave as well as we have S wave. See, we have R wave and we have S wave as well. But you have to see which one is dominating. R wave is dominating. So you will say we have a predominant upward deflection. Always use the term predominant upward deflection. And in this ECG tracing, we have R wave and we have S wave. So which one is more prominent? S wave is more prominent. So you will say we have a predominantly negative deflection. Why? Because S wave is more deeper than the R. And what is equiphasic? When both are of equal size, height, or depth, right? Okay. Now, why we choose lead 1 and AVF? Hanji, can anyone tell from my PGRs or from the audience? Very good, very good. Yes. Why we choose lead 1 and AVF? First of all, we have to look at the axis of the heart. The longitudinal axis of the heart is inferior and lateral. Yes, infralateral. So if we draw the AVF on the graph paper, so AVF lead it represents the inferior side of the electrical activity of the heart. And the lead 1 represents left side of the electrical activity going on inside the left side of the heart. So both of these make what? Infralateral axis. Exact axis as that of the heart or the electrical activity of the heart. What do you say? So we take these two leads, first of all, because they are not only in the same axis as the heart, and secondly, because both are perpendicular to each other. We have to choose two leads which are perpendicular to each other. Perpendicular, as you can see, these are exactly intersecting each other at right angle. So that's why we choose these leads. Got it? So how QRS complex should appear and why? So it's just a repetition of yesterday's lecture. As we know that the positive deflection, first of all, in lead 1 and lead AVF, we should have a positive deflection. Why we should have a positive deflection? G, can anyone tell? Because, yes, very good. Because the electrodes are placed such that they are detecting the electrical activity is moving towards them in a normal heart. Now, let's dig deeper. Now, if there is some pathology in the lateral side of the heart and there's something wrong with the conduction pathway on the lateral side of the heart, and let's suppose that the electrical activity has diverted to the opposite side, like instead of going towards the electrode, it starts moving away from the electrode. So what will we get? We will get a negative deflection. So understandable? And same goes for this. Same goes for this. Now, same goes for the inferior lead. Now, when the electrode starts detecting there's something wrong with the electrical activity in the inferior part of the heart or the myocardium, you can say more precisely. So it will detect that electrical activity is moving away from it. It's going somewhere else. It's not coming down. We will have a negative deflection. Okay. Now let's label these two sides. This is the left side of the heart. This is the right side of the heart, or like whatever. Okay? This is the left side. This is the right side. I have just labeled the two sides for more clarification and more like ease of understanding. Now, just have a look on this side of the screen. As you can see over here, that this is the lead 1 and this is lead AVF. Now, in these two leads, the QRS complex is upward, means positive. So if we draw it here, let's say I just marked it here. Now, as I have said that it is positive in lead 1 and it's as well positive in lead AVF. So we are on this side of the quadrant of whatever. Okay, so it will be what? It will be normal axis of the heart. So this is the normal axis of the heart. This is known as quadrant approach. So anyways, so just draw a circle, divide it into four quadrants. And this one is the normal axis of the heart on this side. Because what is the axis of the heart? Inferior and lateral. Now, coming to the other slide. Now over here. Now in this slide, as you can see, lead 1 is positive. So I will mark it here. And the AVF is negative. So I will mark it here. Sahi? So it will come over here. It will cover this quadrant. So this is the left side of the heart. It means, left side of the quadrant. This is the left axis deviation. We call it left axis deviation. All right. Now coming to the third picture here. Now in lead 1, we have negative deflection. So where is the negative deflection of lead 1? It's here, the opposite side, na? Yes. Now in AVF we have positive deflection. ये हमारा ये वाला छुप गया इधर, ठीक है? Positive deflection, yes. So it covers this quadrant of the heart. So what is this side? Right side of the quadrant. This is right axis deviation. Let me write it. It was left axis deviation. We write it like this. This is right axis deviation. I will repeat it later. Don't worry. Now this is left axis deviation. This is right axis deviation. Now coming to the last part of the ECG. Now we have a negative deflection here. As you can see, ठीक है? Negative deflection है इसमें. We will mark it here. ठीक? We have negative deflection in AVF. We will mark it on the quadrant side, like over here. So this is the right side, but we call it extreme right. We call it northwest. We call it intermediate axis. So it has many names, and this one is the more dangerous form. Why? I will tell you. When you get both when you get ECG tracings which have predominantly negative QRS complexes in both the leads, lead 1 and AVF, that indicates a worse situation, because it means that extreme right, northwest, totally going somewhere else. It shows extreme pathology of the conduction pathway. It shows that current is not going towards its destination. It is distracted. It is hijacked. Something is wrong. It's going somewhere else. You have to be very, very conscious when you get this situation. So it is just a reinforcement of what we just have learned. This is the quadrant approach. It is the normal axis. Now just tell me, in the normal axis, what kind of deflection we will have in lead 1 and lead AVF? Both will be positive. इतना ऊंचा बोलें कि मेरी online audience. Okay. Now, in case of left axis deviation, now what we will get? Very good. We will get a positive in lead 1 and negative in lead AVF. Very good. In case of right axis deviation? Very good. We will get a negative deflection in lead 1 and positive deflection in lead AVF. Very good. And in case of northwest, we will get negative deflection in both of the leads. Very good. Shabash. Chale. समझ आ गई आप लोगों को. I want response from the online audience. Now, this is positive, this is positive, both are positive. What is the axis of this? Let me open the chat box. Ji, बताएं. This is normal axis. Very good. Yes, this is a normal axis. Now, lead 1 is positive and lead AVF is negative. So what is the axis of the heart? Left. Very good. Yes, this is a left axis. Very good. Yes, it is left. Now, lead 1 is negative and lead AVF is positive. G. So what is this? Right axis. Exactly. Great. आप सबके आंसर्स ठीक है. Ahmed, Fatima, Humaira, and Doctor, I don't know, with some name, and Jennifer. Yes, Jennifer, you are right. And Humaira, yes, you all are right. So this is a right axis deviation. Now coming to the last slide, this is, of course, kya reh gaya baki? It is the northwest extreme right, and that's now about the pathological left axis deviation. Now I will tell you another concept. When you will say, now, when you will get a left axis deviation on the ECG, not right axis, I'm talking about the left axis now. When you come across a left axis deviation on ECG, you have to look for another thing. What is that? And then you have to label, is this a pathological left axis deviation or is non-pathological? It's maybe due to some other reason. Now, let's see how you will do that. Okay. First of all, you are going to examine the QRS complex in the lead 1 and lead AVF to determine if they are predominantly positive or the predominant negative. Ho gaya? So you will decide that it's left axis deviation. Now, in the event that the left axis deviation is present, now look for the QRS complex in the lead 2. If in the lead 2, there is a deviation, predominantly negative deviation, it means that it's pathological. But if the QRS complex in lead 2 is predominantly positive, then it means that left axis deviation is non-pathological. I will show you an ECG, another ECG, and then you will understand. In other words, the axis is normal, or if it's a normal finding. It's not pathological. And if it is predominantly negative in lead 2, the QRS complex, it means it is pathological. I will make you understand by showing you, oh, I don't have to show anything. I just have a mental math. So let me explain it again. When you come across left axis deviation in the ECG, you have to make sure that it's pathological or it's a normal finding, it's a non-pathological. How you will do that? You have to look for QRS complex in the lead 2 to make sure. So if in the lead 2, QRS complex again is negative, it means it's pathological. So your finding is right. Let's say in the lead 2, it's upward, it's positive. QRS complex is positive in the lead 2. It means your finding was not pathological. The left axis deviation was not pathological. It's easy. समझ आई? चले. Now let's do the mental exercise. आप लोग भी आंसर करोगे और हमारी ऑनलाइन ऑडियंस भी आंसर करेगी, ठीक है? हम जल्दी से भी करेंगे, आप लोगों ने आंसर्स करने हैं. Ready for the mental round? चलें जी, बताएं, what is this axis? You have to look for in which two leads? 1 and lead AVF. And let's say you find that that it's left axis deviation, then you have to make sure to look into the lead 2 as well. चले, अब बताएं ये क्या है? Okay, अब my online audience come up with that. What kind of axis is this? In lead 1 we have Ahmed and Jennifer. Please look again. This is not normal axis. I'm sure it is not normal. Jennifer, look again. It's totally fine. You can come up with a wrong answer. That's totally fine. At least you are trying, but just try another time. Try again. The people who are saying it's right, yes, it's right. Why it's right? We have a negative in the 1 and the positive in the AVF. So it is the right axis deviation. Yes, this is a right axis deviation. Yes, Jennifer, you are right now. One is negative, AVS is positive. Yes, so it is right axis deviation. Yes, Ahmed, you're right. Very good. Chale. Let's confirm your answer. Now, tell me what axis is this? Lead 1 is here. Lead AVF is here. This is AVF. This is lead 1. This is again. Okay. G, online audience, what is this? Good. Yes, very good. Well done. So everyone is getting the whole thing. Okay, great. Chale ji. ठीक हो गया? Next slide. Now about this slide. Let's see what they are saying. Left, or now tell me, is this pathological or it's non-pathological? बिल्कुल ठीक कह रहे. My PGRs are right, and let me see. Show me that you understood it as well. Yes, pathological. Very good. Excellent. So सबको समझ आ गया. Great. This is a pathological left axis deviation. Now this one, we have lead 1 over here, and we have lead AVF over here. So what is this axis? This is the right axis deviation. Yes, it is right axis deviation. Good. G. और ये वाला? इतनी छोटी सी अभी समझ भी नहीं आ रही वैसे मुझे भी. Let's see. So this one, this is left. G, left. Exactly. Good. Yes, Jennifer. G. Okay. So this one is the predominantly positive in lead 2. It is, yes, it is left axis deviation, but because this is not predominant over here, it is more predominantly like upward. So it is non-pathological left axis deviation. ठीक है? चले ये वाली तो मैंने मार्क भी किया हुआ पर already marked. Very good. This one is pathological left axis deviation. So my online audience, you guys are with me, right? Pathological left. Yes. Good. Very good. Challenging. Yes. All right. Thank you for your feedback. Challenging. ठीक हो गया? ये वाली? Again, this is the same pathological left axis deviation. ठीक है? इसमें 1 AVF कहाँ है? This is the 1. This is AVF. This is a pathological left axis deviation. ठीक है? PL is a pathological left. Yes, very short for the pathological left axis. Jennifer, too short. PL. All right. So this is pathological left axis deviation. Okay, now. So that was it about the axis deviation. So you all are champions in it now. Let's apply it with different conditions of the heart, like let's apply it to identify it's a ventricular hypertrophy, it's LBB, it's MI, or what and what. Let's see. So now coming to the hypertrophy, thickening of the ventricular muscle, V1, V2 reflects the right side of the heart, and V5, V6 reflects the left side of the heart. In case of hypertrophy, there will be left axis deviation. It's not necessary to always have axis deviation in the hypertrophy findings or in the bundle branch findings, but if it is there, if axis deviation is there along with the other findings, it just strengthens your diagnosis. There may be left axis deviation, or there may be S wave and R wave both combined should be more than 35, or individual R wave may be more than 12 mm in AVL. There may be associated secondary ST depression, more strengthening your diagnosis. There may be asymmetrical T wave inversion, further strengthening your diagnosis, further strengthening your criteria. And these are most frequently seen with the hypertensions. hypertensive patients. Okay, now about the right axis deviation. There will be right ventricular hypertrophy. There may be associated with right axis deviation, not always, but there may be. If it is there, it will strengthen your criteria. Now, what will be the voltage criteria? There will be a tall R wave in V1, V2. Now, this is the reverse of the findings of the normal findings. This is the reverse of it. I will tell you later why you will have a tall R wave in V1. Because normally we don't have a tall wave in V1. We have S wave in V1. But in case of right ventricular hypertrophy, we are getting a positive deflection. That is something opposite of the normal finding, reverse of the opposite finding. Why? And then and still we are having, and another finding is we are having a deeper S wave in V6. We can also have this finding as well. Small r, a large S wave, and again a small R wave. That is, we call it the second R wave, R prime, in the V1 lead. It may be associated with it. Not always, but it may be associated with it. We may have a secondary ST depression that will strengthen our criteria, and we may have strain pattern on ECG that will again strengthen our criteria. If it is present, it is strengthening our criteria. But it may not be present as well. So that's all right. So usually it may be seen with the pulmonary pathology. Right axis deviation, when there is right ventricular hypertrophy, it may be associated with, or it may be secondary to pulmonary pathology. Okay. So now let me show you some ECGs and you will get the whole picture, and for more for more better understanding. Now, अब इसको देख के आपको ज़्यादा अच्छा समझ आएगा. Okay. First of all, this is let me draw the lines here. Okay, now, as I have already mentioned, the lead V1 represents the right side of the heart, V1 and V2 most of the time, and V5 and V6, or only V6, represents the left side of the heart, for your understanding. Now, this is the normal ECG. This is ECG for LVH. This is ECG for RVH. So this is lead V1. This is lead V6. Now, in the normal ECG, we usually have a prominent S wave in lead V1 and a prominent R wave in lead V6, right? In case of left ventricular hypertrophy, the findings will remain the same. Like, as you can see, the S wave is deeper here, R wave is prominent here, but with a little bit of difference is that the S wave will become more deeper in lead V1, and R wave will become more taller in lead V6. Findings will remain the same, but the findings will be exaggerated or enhanced in case of left ventricular hypertrophy. In case of right ventricular hypertrophy, findings will reverse. Instead of having a deep S wave, we will have a prominent R wave in lead V1, and instead of having a prominent R wave in V6, we will have the opposite of it, a prominent or deeper S wave in lead V6. In case of right ventricular hypertrophy. Why? Because current is moving away from the left side to the right side, because the muscle mass is more on the right side because of the hypertrophy. Okay? Look at this ECG. It has the following findings. First of all, it has left axis deviation. And interestingly, it is pathological. We have a positive here, a negative here in AVF. It is a left axis with, this is pathological. Now, do we have any ST depression here? We have ST depression here. A little bit. Acha. Uske baad we have inverted T waves. We have inverted T waves. It is very clearly asymmetrical because one limb is sloping and the other part of the ECG is rounded. So that was an ECG with all the positive findings, or having all the findings fulfilling the criteria. of left ventricular hypertrophy. Let's do some mental exercise. Yes? Kareem, are you ready? So now you will tell me, what is this? G. This is LVH. Why? Let me explain it again for you. In this ECG, there is no left axis deviation. First of all. Now, secondly, the findings are the same. There is no reverse finding. Secondly, we have a more deeper S wave here and more taller R wave here. The normal findings are enhanced. Hence, it is left ventricular hypertrophy. ठीक हो गया? G, Saima, you are right, bete. So now tell me, what is this? Because we are talking about the LVH or RVH, so look in the lead V1 and V6. Just फिलहाल आप axis deviation को जाने दें, छोड़ दें. Just look in the lead V1, V6. So this is V1, this is V6. Now in V1, usually what do we have? Normally we have S wave, but right now we are having R wave. The findings are reversed. It means there is something wrong. There's something wrong with the right side. Our right side में क्या है? We have strain pattern here. Can you see? ST depression with strain pattern. It is confirming, and we have right axis deviation. So it is the RVH. This is RVH. Good. Yes. I'm glad that my online audience is also just having the whole concept and they are with us. Good. Now about this. G, about this. Now, as you can see, indeed V1, normally we have R wave, normally we have S wave, and normally we have predominantly R wave. The findings are same, but findings are enhanced, as you can see. So it is LVH and further strengthened by the left axis deviation we have here. ठीक हो गया? समझ आ गई सबको? इंटरेस्टिंग? चलें जी, आगे चलते हैं. Now let's take a break. चुप तक पड़ा है absorb हो जाए. Just take a 1 minute break and we will come back to the bundle branch block. Now talking about the bundle branch block, when we talk about the bundle branch block, we are strictly talking about the conduction blocks. Conduction pathway, any condition, abnormal condition related to the conduction pathway, bundle branch block. Now, just a quick repetition of what we have gone through yesterday. As we know that SC node generates an electrical impulse, it just arises from here. It goes to the right atria, they contract, it goes to the AV node. After a very small fraction of stay in the AV node, it goes to the AV bundles and then to the right, left bundles. When there is any pathology here, it will be a left bundle branch block. Talha, on the screen, please. Okay. So it will be, if there is any pathology with the left side of the conduction pathway, we will have a left bundle branch block. And if there is any pathology lying here, it means the connection is, there is a disconnection of the electrical impulse going further down, we will have a right bundle branch block. So this is such an easy idea, such an easy, simple concept. ठीक? यहाँ तक clear? So this is not much about it. Now let's see what's important and how you will diagnose that it is right bundle or left bundle. Now about the LBB and RBB. Okay, the rule is the same. V1, V6 will be right and left respectively. V1 lead will represent, or V1, V2 will represent the right side, and V5, V6 will represent the left side, first of all. Secondly, same rule will apply here. Almost same rule will apply here. In case of any pathology lying in the left bundle branch block, like any pathology in the left bundle or left side of the heart, we will have the same findings with enhanced features. In case of right-sided pathology, we will have reverse findings, जैसे उसमें हुआ था, as we have already learned in the ventricular hypertrophy. That rule will apply here as well. We will have normal findings with enhanced features, exaggerated features, in case of left heart pathology, left bundle branch block, and in case of right bundle branch block, we will have reverse findings, opposite findings of the normal finding. ठीक है, जो नॉर्मल होता है उसके ऑपोजिट हो जाएगा. चलें जी, अब इसमें क्या होगा? फर्स्ट ऑफ ऑल, the duration of QRS complex will increase. ठीक है, it will be more than 120 milliseconds, यानी कि more than 0.12 seconds, or 3 small squares, more than 3 small squares. Second, you have to look, first of all, look in the lateral leads, more precisely V5, V6. Now, what you will get a broad R wave, a more enhanced feature, a more exaggerated finding, exaggerated of the normal finding. You will have a more prominent R wave that is more broader, and it will be slurred, it will be notched. I will show you how. Oh, as you can see over here, yes. In lead V6, the lateral lead, you will have a enhanced, exaggerated R wave that is, as you can see, more broader, taller, and it is notched, slurred, it's notched. And Q wave may be absent, may be present, maybe absent. And axis deviation may be associated with it. If it is associated, that's fine. If it is not there, that's fine. Again, I will say, if it is there, it will just reinforce your finding. It will just strengthen your findings, and that's all. Now, coming to the RBB, again, you will have a prominent QRS complex, means it will be more than 0.12 seconds or 120 milliseconds, or you can say 3 small square. Now, about which findings you will see. In lead V1, the right side of the lead, the right side of the heart, you will get a prominent R wave. See, again, वही वाली findings जो LVH में थी, but क्या होगा? More broader and notched. Broader and notched. With or without notch भी हो सकती है, but usually. And if it is not notched, it will be slurred. Slurring क्या होती है? I will show you. I will show you what is slurring. And left-sided leads, there will be a prominent S wave. S more than R means there will be a prominent S wave. Same as in, we have just already gone through that, the hypertrophy. S wave बड़ी होगी, R wave छोटी होगी, all that. ठीक है? And in the lateral lead, S wave will be more prominent. In V1 lead, the right side lead, R wave will be more prominent with slurring. Again, this will apply here, that you will have a more prominent S wave with slurring or notching. I will show you how you will have this. Oh yes, we have this over here. We have this above in the top of the screen. Yes, in the V1, we will have a more prominent R wave, as you can see. But this will not be a regular R wave. So it will be notched or slurred, or you can say it will be small r, small s, and then with a large R wave. The second R wave, R prime, we have already discussed yesterday. We call it R prime. ठीक है? अच्छा, अभी हम इसकी ECG देखते हैं दोबारा से. The right-sided leads, V1, V2, there may be RSR pattern, RS capital R pattern, R small, capital S, capital R pattern. For those who were not present in my yesterday's class, we are with this, इसे क्या बोलते हैं? Hyphen? apostrophe. So R with an apostrophe top on it, we call it R prime. It indicates a second R wave. Second R wave means total disaster of the conduction pathway. Hijacked. System is hijacked, going somewhere else. अच्छा, ये सिर्फ दिखाने के लिए कि waves R, S, R pattern वो सब क्या होता है. Now let me show you. This is the small r, small s, capital R. You may have this pattern, you may have this pattern, you may have this pattern. अभी हम पिछली स्लाइड पे दोबारा चलते हैं, मैं आपको एक और चीज दिखाती हूँ. We call it WM pattern in LBB. We call it MW pattern in RBB. People call it William, they call it Morrow. William, WM, W will be seen in the V1, M will be seen. As you can see, this is a small m here. It looks like M, it's not M, it's RR, but it appears to be M. So coming here, you will have M in the lead V1 and W in the lead V6. As you can see, it is a reverse of the, again, WM ka reverse hai na? Reverse of that. So for reinforcement, now have a look at that. चलेंगे देखिए हम. In lead V1, this is a normal pattern we see, a normal deep S wave, a normal tall R wave. In case of LBB, we will have the enhanced features. The R wave there will be R wave, but there will be S wave in lead V1, but it will be more deeper, broader, and it will be notched. W, William. Have enhanced S wave and enhanced exaggerated R wave in respective leads, and this will make a shape of W, and this will make a shape of M. Now coming to the RBB, findings will reverse. You will have a prominent R, balki you have two R's, prominent S wave in the lead V6, and it will be broader, and it will give it a shape of Morrow. So W on this side and M on this. As you can see, it is making an M. This is making M, as you can see. Now let me show you other ECGs. So this one is another ECG tracing. Now we will go for a mental exercise. Are you ready, everyone? चलें देखिए online audience में कौन-कौन रह गया है, who will going to participate. जी, चलें start करें. जी बताएं, ये क्या है? Look at the lead V1 and V6. So what is this? Normally we have S wave in V1, normally we have R wave in V6, but these findings are enhanced. This is the slurring I was talking about. As you can see, this is the slurring. ठीक है? So this is LBB. Very good. LBB, good. Okay, Safiyullah is also here now. चलें, साइमा, yes, you are right. और ऊपर सबके आंसर ऊपर चले गए, मुझे नजर नहीं आ रहे. चलें, नेक्स्ट दिस LBB. जी, ये क्या है बताएं? Normally we have S wave, now we have R wave, and this is a very beautiful M pattern here. MW, Morrow. We have, ये है हमारी V6, sorry, ये V6 है. So we don't have like a proper W here, but we have M here. So this is Morrow, means this is RBB. जी, बिल्कुल ठीक हो गया. You're getting it right. चलें, ये वाली क्या है? This is V1, this is V6. शाबाश, तेज हो गए सारे. Good. This is LBB. What is this? इसके साथ MIB है. चलें, अब बताएं. वैसे ही आपको समझ नहीं आएगा. ये वैसे LBB है, क्योंकि LBB with MI है. You have to look for the curious complex duration if you are not sure. ठीक है? Now, which one is this? This is V1, this is V6. So what is this? This is a very beautiful RBB. Not for the patient beautiful, but for you to understand it. RBB. ये क्या है? So what is this? This is again RBB. Why? Because the findings are reversed. We have tall RBB, broad, notch, slurred, blurred, everything whatsoever. Okay. G, this is RBB. Very good. Yes, you all are right. What is this? This is LBB because of the tall, broad, slurred. This is slurring, slurred wave. ठीक है? LBB. What is this? This is RBB. ST elevation भी है? कहाँ है? With MI. This is RBBB with MI. इस्कीमिया बस इसको जल्दी से खत्म करते हैं. मेरा ख्याल था आज हम 2 कवर कर लेंगे लेकिन ischemia. First of all, there are different types of ischemia. Just a brief know-how about that. This is the normal ECG, as we have already discussed yesterday, that we compare the ST segment with which segment for the baseline? PR segment. When we have to comment that ST segment is elevated or depressed, we compare it with the baseline. And which was the baseline? Baseline is SPR segment, जो कि इसमें नजर नहीं आ रहा. अच्छा. So anyways, so this is ST depression. This is ST depression horizontal. This is downslope. This is ST elevation above that, as you can see. नीचे क्या है? This is T-wave inversion. अच्छा. This is subendocardial ischemia. You are not cardiologist. We all are not cardiologists, but just to have an idea, So this is the subendocardial ischemia. When this happens, we call it transmural ischemia. And अच्छा वो आगे आएगा. This is STEMI, ST elevation MI. This is NSTEMI, non-ST elevation MI. And simple T-wave inversion also comes under that definition. Coronary supply, I'm not going into details because this is not our main focus. Our main focus is ECG reading, not coronary reading. But again, just a little repetition of that, which lead will represent which side of the cardiac activity. You can take a screenshot of it. And this is just that. Now, this is LAD. This is not left axis deviation. This is actually left anterior descending artery, and this is the right coronary artery. It's just going to tell you that when you have when you are going to see the ECG and there are findings in these leads, it means their problem with this artery. So you can just have a screenshot because you have to memorize it. Chale. Achha, these are some other the ECG is showing STEMI, non-STEMI. This is STEMI, ST elevation. This is NSTEMI, non-ST elevation MI, non-STEMI. NSTEMI भी कहते हैं. ठीक है? This is also NSTEMI. ठीक हो गया? इसमें इतना ही है. चलें, let's do some mental exercise. आपको सिर्फ ये बताना है कि this is which side of MI. ये हमारी आखिरी slides हैं, and then we will end the session. What is this? कौन सा MI है ये? AVF में भी है और वो क्या कह रहे हैं बच्चों को सुनो जरा. दे आर सेइंग स्टेमी है, इंफीरियर है. ओके, इंफ्रोलैटरल कह रहे हैं सफीउल्लाह. अच्छा, देखते हैं कौन सा. जी आप लोग क्या कह रहे हो? क्या है? पहले ये बताओ कि ये क्या है. इंफीरियर वॉल एमआई. दिस वाज इंफीरियर वॉल एमआई. जी मेमूना आप क्या पूछ रहे थे? जी व्हाट इज दिस? Anterior wall. Ahmed saying anterolateral, doctor with no name. They are saying anterior wall. Okay, let's see what is this. This is anterolateral because V5, V6 are the lateral leads. So this is anterolateral. Now, what is this? Now, comment on this. एंट्रोसेप्टल लग रहा है मुझे तो V4 तक है एंट्रोलेटरल अच्छा जी बाकी लोग हाँ जी बच्चों पीजीआरस क्या है नहीं समझ आ रही एंट्रो समझ आ रही है आगे क्या है लेटरल एंट्रोलेटरल है ओ कहाँ गया उसका नाम नहीं लिखा हुआ था मैंने क्यों नहीं आ रहा लिखकर बहरहाल एंट्रोलेटरल ही है ठीक है चलें आगे ये वाला थोड़ी सी इधर A1 और AVL में चेंजेस तो आ रही हैं सो एंट्रोलेटरल लिखा हुआ है नीचे अच्छा सो दिस इज एंट्रोलेटरल और ये वाला एंड दिस वन एंट्रोलेटरल है जी ऑनलाइन ऑडियंस आप लोग थक गए हो जी ये वाली ECG इसका बताएं साइमा अहमद जेनिफर एंट्रोलेटरल ओके एंट्रोलेटरल ये वाली अच्छा इसके साथ बंडल ब्रांच ब्लॉक भी है लेकिन आपने बताना है कौन सा वाला है नाउ दिस ECG इज अ चैलेंज क्योंकि आधा जवाब तो मैंने दे दिया आपको और MI तो है ही है और ST एलिवेशन MI है सात बंडल ब्रांच ब्लॉक है जी कौन सा वाला है ये लोग क्या कह रहे हैं दे आर सेइंग इंफ्रोलेटरल LBB है इंफ्रोलेटरल है ओके जी बताएं हमारा सदफ LBB जी ये है जनाब एंट्रोलेटरल MI LBB के साथ है ठीक है एंट्रोलेटरल MI सारी में है ना V1 से लेके V6 तो एंट्रोलेटरल हो गया और साथ LBB भी है ये वाला बताएं जी ये वाला बताएं वन में है AVL में ST एलिवेशन है और कहाँ नजर आ रही है तो लेटरल लीड्स तो हो गई और भी कहीं है दिस इज लेटरल वॉल MI ठीक है